So, a 60 years old diabetic male admitted with history of acute gastroenteritis. On day 3 of admission, he is complaining of respiratory distress, right-sided pleuritic chest pain and having hypoxia. Okay, so day 1 X-ray was absolutely normal, but day 3 X-ray showing presence of right middle lobe pneumonia, but his initial chest X-ray was normal. So, what is the diagnosis? What is the diagnosis? Why this is hospital acquired? Because it's occurring more than 48 hours after admission of the hospital. Okay, so this is hospital acquired pneumonia or nosocomial pneumonia. Next, so she ingested kerosene day 1 back. Since then she is complaining of dry cough with left sided chest pain, but she is not having fever or hypoxia. So what is the diagnosis? Is it So this is aspiration pneumonia or chemical pneumonitis or community acquired pneumonia. So this is chemical pneumonitis. This is not aspiration pneumonia, because ekhane kono ei patient there is no such history that predispose aspiration, right? The patient is not bedridden, the patient is not alcoholic, or the patient is not suffering from any cerebrovascular accident or any such incident, right? But the patient ingested kerosene day 1 back. So this is a chemical pneumonitis. This is not a pneumonia. This is not a infection, but this is inflammation of the parenchyma, right? "70 years old, prolonged bedridden, semi-conscious patient admitted with history of cough with mucopurulent expectoration and low grade fever for last 7 days. So this is a case of X-ray, chest X-ray showing a pneumonia. This is a pneumonia, right? Air bronchogram or patchy opacity involving right lower zone. So this is typical of which type of pneumonia? So this is aspiration pneumonia. Why this is aspiration? Because patient is semi-conscious, right? So there is a risk factor. Second thing is that the fever was low grade. So in aspiration pneumonia, as the aspiration pneumonia causes organism, mostly they are less virulent and they are less pathogenic in nature, and they are mostly anaerobic in nature. So the fever will not be of high grade. This is low grade, and this is typical location of aspiration pneumonia. Why? Why right lower zone of X-ray is the most common site for aspiration? First, because this is a dependent position, right? This is a gravity dependent position. যখন patient শুয়ে আছে bedridden, তখন this is the dependent position segment. Dependent segment is the right lower lobe, the anterior aspect of the bronchopulmonary segment of the right lower lobe. This is the most dependent portion. Second thing is that right bronchus is shorter and wider, right? And this is a acute angle. So any aspirated content easily pass through the right lower lobe bronchus and can cause pneumonia in this site. So this is the most common site for aspiration. So the stage of gray hepatization, which will be the answer? So first is 1 to 2 days congestion. Second, red. Next is gray. So 4 to 6 days is the answer, right? So hyponatremia is associated with pneumonia caused by, এটা আমি কিন্তু আগের স্লাইডে বলেছিলাম, আগের কিসে বলতে organism. What is the organism? হ্যাঁ, answer? Legionella, right? Legionella can cause hyponatremia. And what about leptospira? লেপ্টোস্পাইরা, লেপ্টোস্পাইরার আরেক নিউমোনিয়ার আরেকটা নাম কি? What is the other name of leptospira pneumonia? So this is icterohemorrhagic fever. বলেছিলাম না নিউমোনিয়া অ্যালং উইথ জন্ডিস, যদি পেশেন্টের নিউমোনিয়া অ্যালং উইথ জন্ডিস থাকে and patient is having hemoptysis, then you must have to rule out leptospira. Okay. So 26 years young male, high grade fever, cough with mucopurulent expectoration, BP is 90/60 and he is having severe hypoxia. He is an IV drug abuser and suffering from infective endocarditis as well. So which is the most probable etiology of pneumonia? Staph. So this is a bronchopneumonia pattern, right? So this is bronchopneumonia. So the correct answer is Staph aureus. A 50 years old diabetic male with history of cystic fibrosis. So this is a structural lung disease. Admitted with fever and left sided chest pain with mucopurulent expectoration. So this is which organism? Pseudomonas. আর কি organism হতে পারে? This is Pseudomonas, but আর কি organism may predispose to this type of pneumonia in patients of cystic fibrosis? Structural lung disease থাকলে Klebsiella, Pseudomonas and Staph aureus also. So next is clinical examination. Any idea একটা patient OPD তে তোর কাছে pneumonia নিয়ে এসছে, so what you might expect from this patient? কি expect করছিস, কি পেশেন্টের ক্লিনিক্যাল এক্সামিনেশনে কি পেতে পারিস? কোনো আইডিয়া? No, first general examination. General examination কি পাবি? Patient is maybe tachypneic, patient may have tachycardia, right? Next, patient is having severe pleuritic chest pain with fever. এগুলো হিস্ট্রিতে আসবে, জেনারেল হিস্ট্রিতে আসবে, right? Next, on general examination, pallor might not be present, but pallor is not associated with pneumonia. Eta pallor is not specific to any pneumonia, right? Second, clubbing will be present or not? Clubbing typically is not associated with any kind of pneumonia, but if pneumonia is complicated with other complications like lung abscess or bronchiectasis, then clubbing may be present. Third, cyanosis. Will cyanosis be present in a case of pneumonia? Yes. If the patient is hypoxic, then cyanosis may be present. So which kind of cyanosis will be there? Central or peripheral? Which kind of cyanosis? Peripheral কারা কারা বলছিস? হ্যান্ড রেজ কর। Why peripheral? যারা বলছিস why peripheral cyanosis? No. So the central part, the lungs itself is not receiving oxygen. So why you are bothering about the peripheral part? So this is a central cyanosis because this is caused typically due to hypoxia, right? And if you administer oxygen, the cyanosis will be reversed. So this is a central cyanosis. So what will be the sites for you look for central cyanosis? কোন সাইটে সেন্ট্রাল সাইনোসিস দেখা যায় দেখবি? Any idea? একজন বল। Inner aspect of lip. Second, tip of tongue, under surface of tongue, palate, mucous membrane. So these are the sites for central cyanosis plus the sites of peripheral cyanosis. Okay. And blood pressure may vary. If the patient is having severe pneumonia, the patient may present with septic shock, that is systolic blood pressure less than equals to 90 or diastolic blood pressure less than equals to 60. And the patient will be tachypneic, jaundice will be present or not? Jaundice will be present or not? Yes, in case of leptospira, jaundice may be present. On inspection, the patient is tachypnic and there is increased use of accessory muscles of respiration like sternocleidomastoid, and intercostal suction may be present. Next, on palpation, vocal fremitus may be heard. What is vocal fremitus? What is vocal fremitus? Demonstrate করতে পারবি কিভাবে vocal fremitus দেখে? Ulnar border of the hand, you would place your ulnar border of the hand কোথায়? On the chest wall. Next, কি বলবি patient কে? Yes, 3 3 3 or 9 9 9, anything, 9, anything. So you would feel the vibration along with your ulnar hand, right? Next, percussion, dull note may be present. On auscultation, there may be bronchial breath sound. So how do you differentiate between vesicular and bronchial breath sound? What is bronchial breath sound? Differentiation. So normal is vesicular breath sound, right? So in case of bronchial breath sound, the pitch is higher than the vesicular breath sound, and there is a gap between inspiration and expiration, and the inspiration time and expiration time will be similar, right? Crepitations may be heard. So what is crepitation? Any idea what is crepitation? কিরকম শোনে crepitation, কিরকম শুনতে লাগে? This is a other name of crepitation is crackles. So there are two types of crackles, fine or coarse, right? So in case of pneumonia, at the initial part of pneumonia, the crepitation will be fine crepitations, right? Because কি জন্য crepitation হয়, that is very important, because of the secretion. The air passes through the secretion that is present in the bronchiole, right? So this causes crepitation. ঠিক আছে? তো ইনিশিয়াল স্টেজে নিউমোনিয়া যখন ইনিশিয়াল স্টেজ হয় তখন কি হয়, তখন হচ্ছে the secretions will be lower, ঠিক আছে? So the crackles that is fine in nature, this is called index crepitus, right? Index crepitus. And at the later stage of pneumonia, there will be redux crepitus, because the crepitations may be heard as coarse crepitation, because তখন কি হয়, তখন secretion বেশি হয়ে যায়, right? So the crepitations will be coarse. So this is index and this is redux crepitation. Then radiological examination. So the most important radiological examination is chest X-ray, followed by HSCT thorax and USG thorax, okay? So this is a brief overview of X-ray, right? So this is the lung parenchyma, okay? This is diaphragm, and this is, what is this? This angle is called costocardiac angle, and this is costophrenic angle. This is diaphragm. So this is the clavicle and these are the ribs, okay? And this is the pulmonary artery. So is this a pneumonia? This is a pneumonia. Any inhomogeneous opacity may present as a pneumonia, right? So this is a inhomogeneous opacity. Is this pneumonia or not? So this is not a pneumonia, because the distribution of the inhomogeneous opacity, this is typically hilar, right? That just the hilar part is involved, but not the peripheral part. Periphery of the lung is spared, right? So this is not a pneumonia, this is heart failure. But this is a pneumonia, right? That periphery of the lung is involved. ঠিক আছে? So this is a pneumonia. The pathognomic feature of pneumonia in X-ray is presence of air bronchogram. So what is that? Air bronchogram ki? What is air bronchogram? দেখ এখানে compare these two X-rays, এখানে এই এরিয়া compare কর আর এই এরিয়া compare কর. So there is a, this is a inhomogeneous opacity, right? There is a black shadows over there. This is a black shadow. This is a black shadow. So this is air bronchogram. At a inhomogeneous opacity background, white background, there are some black dots. This is representing bronchus, because ki hoy pneumonia te bronchus is filled with the secretion, right? And the periphery of the bronchus is opacified because of the consolidation part. So the bronchus is visible, the air of the bronchus is visible, not the peripheral part. So this is air bronchogram, right? So types of pneumonia. What are the types of pneumonia? According to the site, what are the types of pneumonia? Lobar, segmental, bronchopneumonia and interstitial pneumonia. So this is what type of pneumonia? Bronchopneumonia. So what is the most common cause of bronchopneumonia in India? Well, tuberculosis. So this is lobar pneumonia. This is horizontal fissure. This is also lobar pneumonia. And this is, yes, this is segmental pneumonia. দেখ এখানে কোনো লোব predisposition নেই, right? কোনো fissure bounded কোনো লোব নেই, and this is not a bilateral, this is unilateral pneumonia. Okay, and this is, compare these two x-rays, this one and this one. This is also lobar pneumonia, but এখানে differentiating point কি আছে দেখ, look at the fissure. The fissure is horizontal in this x-ray, but in this x-ray the fissure is bowing downward. So this is called bulging fissure sign. This is typical of Klebsiella pneumonia. And this is not a consolidation. What is this? This is cavity. What is cavity? This is a air filled area surrounded by a consolidation, right? This is a cavity. This represents presence of tuberculosis, primary tuberculosis or secondary tuberculosis. This is a radiological resolution of the X-ray. এখানে কি ছিল? First X-ray was opacified, inhomogeneous opacity at right hemithorax. This is a right-sided pneumonia. So after 2 weeks, this is a X-ray. This is a resolution of the X-ray. But একটা খুব important point হচ্ছে clinical resolution always আগে হয় than radiological resolution. Clinical resolution হয় within 7 days and radiological full radiological resolution হয় 3 to 4 weeks. Next, microbiological investigations. So first microbiological investigation কি আসতে পারে? তোদের মাথায় কি আসছে? কি হবে? Sputum, gram stain, culture sensitivity. This is the primary microbiological investigation. But not to collect saliva. Always collect sputum, thick sputum, not saliva. So this is called pathological sputum. What is pathological sputum? যে স্পুটামের কালচার করলে কোনো অর্গানিজম পাওয়ার চান্স থাকে, that is pathological sputum. So if the sputum is having less than 10 mucus cell with more than 25 neutrophil, so this is pathological. Okay, so sputum examination এ যেটা প্রবলেম হয় to isolate the commensal organism, কারণ sputum যেখান থেকে expectorate হচ্ছে through the upper respiratory tract also, so এখানে mixed up flora with the commensal থাকতে পারে, so you have to isolate that. সেটার আইসোলেশনের একটা way out হচ্ছে this one. If the sputum is having less than 10 cells with more than 25 neutrophil, then this is almost, you are sure that this is a pathological one. Send a sputum for Gram-stain culture, Jaden stain and fungal stain CS. But fungal stain CS routinely সবার লাগে না, কিছু স্পেসিফিক কমিউনিটি আছে যাদের জন্য ফাঙ্গাল স্টেন লাগে, যেমন ইমিউনোকম্প্রোমাইজড, পেশেন্টস উইথ HIV, patients receiving immune suppression drugs or having chemotherapy, right? So these are the strata in which you can order fungal stain CS, but regularly কিন্তু fungal stain দিবি না, কারোরই দিতেন। Also ম্যাক্সিমাম পেশেন্টে কিন্তু ড্রাই কাফ হয়, যারা স্পুটাম এক্সপেক্টেড করতে পারে না তাদের we may induce sputum by the help of hypertonic saline nebulization. Hypertonic saline 3% saline নেবুলাইজ করে আমরা কিন্তু ইনডিউস sputum করতে পারি, ইন্ডাকশন করে সেটাকে Gram-stain কালচার করতে পারি। So always blood and sputum culture to be collected before the first dose of antibiotic, because first dose of antibiotic দিলে কিন্তু কালচারে নাও আসতে পারে কিছু। So the sensitivity of sputum culture for pneumococcal is about 50%, and colony count should be more than 10 to the power 5 CFU per ml. So in case of pneumonia, if the patient is having severe pneumonia or septic shock, then তোকে কিন্তু blood CS along with blood culture along with sputum culture, both specimen should be sent. Next, urinary antigen. Any idea? Urinary microbiology তে পড়েছিস urinary antigen for pneumonia detection কোন অর্গানিজমের করা যায়? Very good, streptococcal pneumonia. আর কিছু? লিজিওনেলা and streptococcus pneumoniae, এদের কিন্তু ইউরিন অ্যান্টিজেনে সেন্সিটিভিটি আছে। সো বাট এটার বেসিক্যালি এখানে আমাদের রিজার্ভ ফর সিভিয়ার কেসেস, not for all. This is not a community one, right? So sputum immunodetection, direct immunofluorescent antibody test in Legionella, Chlamydia and Pneumocystis. The advantage of this test, that sensitivity is not reduced, both of these tests, urinary antigen and sputum immunodetection, because this is a immunological test. এটার সঙ্গে অ্যান্টিবায়োটিক দেওয়ার সঙ্গে বা না দেওয়ার সঙ্গে রেজাল্ট কিন্তু ডিফার করবে না, বিকজ দিস ইজ এ ইমিউনোলজিক্যাল টেস্ট। PCR, হোয়াট ইজ PCR? মেকানিজম, এনিওয়ান? PCR এর কোনো মেকানিজম আইডিয়া? একজন বল। রাইট। সো বেসিক্যালি কি হয় না, এখানে জেনেটিক মেটেরিয়াল অফ দ্য অর্গানিজম কি হয়, তাকে ডিন্যাচুরেট করে প্রলিফারেট করা হয়, রাইট? সো দিস ইজ the most important and most common PCR technology used for pneumonia is for tuberculosis. This is in term of CBNAT or gene expert study, right? But in case of viral pathogen, DNA PCR may be used. So especially in case of Coxiella pneumoniae, there is a use of IgM serology titer. There must be 4-fold rise of IgM antibody titer. So what is the basic blood investigations? Total WBC count. So total WBC count, if the total WBC count is more than 12,000 or less than 4,000, that means the pneumonia may be severe one, right? Renal function test, increased urea and creatinine denotes severity. Electrolytes, specifically in case of which pneumonia? Legionella, hyponatremia. So other inflammatory markers like C-reactive protein and procalcitonin. What is procalcitonin? Any idea? Procalcitonin? কে বলছিস, আমি কিছু একটু মার্কার অফ Bacterial infection, good. Can why not viral infection? Because bacteria যে LPS lipopolysaccharide আছে that inhibits the transformation from procal to calcitonin, right? So এই organism যত load বাড়বে তত procal-এর number of procal is increasing because of the এই যে LPS আছে bacteria LPS or the toxins that is produced by the gram negative or gram positive organisms, they inhibit the transformation of the procalcitonin to calcitonin. Okay. Arterial blood gas may present as type 1 respiratory failure, specifically PaO2 less than 60. So assessment of severity. How do you assess the severity of pneumonia? Because কোন একটা পেশেন্ট নিউমোনিয়া নিয়ে তোর কাছে এলো, রাইট, আউটডোরে দেখা ওপিডি তে দেখাতে এলো, তোকে অ্যাসেস করতে হবে যে would you treat the patient in OPD or would you like to admit the patient in ICU or IPD? There is a specific criteria for that. This is called CRB or CURB 65 criteria. So what is that? C for confusion. Confusion 1 point. U for urea more than equals to 7 millimole per liter. But a urea, because you cannot estimate urea at bedside, তুই OPD দিলে তার তো সঙ্গে সঙ্গে ইউরিয়া দেখতে পারবি না। That's why recently আমাদের গাইডলাইন যেটা বলে that হচ্ছে ইউরিয়াকে বাদ দিতে হয়, CRB 65. Okay. So urea more than 7 millimole per liter. If the respiratory rate is more than equals to 30, and if the blood pressure, systolic blood pressure is less than equals to 90 or diastolic is less than equals to 60, and also the age is 65 years, more than 65 years. So the cumulative point, if the cumulative point is more than 1, then you should consider admitting the patient. Okay, if it's more than 2, you should consider as severe pneumonia and admit the patient in ICU. Okay. Next, after CRB করার পর CRB 65 করলি, তুই পেশেন্টকে বললি তুমি ICU তে অ্যাডমিশন হবে, you are having severe pneumonia, but এইখান থেকে তুই বলতে পারবি না if the patient is having severe or non severe pneumonia. So this is the criteria for severe community acute pneumonia. If one of the major criteria, if the patient is severely hypoxic, that may need intubation or mechanical ventilation, or the patient having severe septic shock. What is sepsis and what is septic shock? What is sepsis? This is not a definition of sepsis. So there is a damage of the end organ or damage of the organs because of the bloodstream infection, right? So this is a dysregulated response of the body to that bloodstream infection. Okay, so this is sepsis. And what is septic shock? Because of the sepsis, if no, circulatory failure কি হবে? Systolic blood pressure is less than 90 and diastolic blood pressure is less than 60, and the patient is requiring vasopressor support to elevate the BP, and the lactate level is more than equals to 2, then you can call it septic shock. So যদি এই দুটোর মধ্যে যে কোনো একটা থাকে, if the patient is having septic shock or patient may need mechanical ventilation, then this is a severe pneumonia. Or in case of minor criteria, if the PaO2 FiO2 ratio is less than 250, if there is multilobar infiltrate like bronchopneumonia, or the patient is confused, the creatinine is more, and if the patient is having leukopenia less than 4,000 cells per millimeter cube, or the cell is more than 12,000, the patient is having hypothermia or thrombocytopenia. These are the criteria. Any 3 of these criteria, যদি পেশেন্টের থাকে, minor criteria, 3 of the minor criteria or any one of the major criteria, তাহলে you can call it as severe pneumonia. So this is another classification. এটা খুব cumbersome, এটা মনে রাখতে হবে না. This is called pneumonia severity index, PSI, pneumonia severity index. So in case of, if the score is more than 90, then you can call it as medium to severe pneumonia. So what are the complications of pneumonia? Any idea? Complications of pneumonia? Any untreated pneumonia? Untreated pneumonia কি কি complication হতে পারে? So there are two types of complication. One is local and second is systemic. So local complication কি হতে পারে untreated pneumonia? Lung abscess. Very good. Lung abscess. What is lung abscess? What is lung abscess? Ball. Very good. Pus-filled cavity in the lung because of the destruction of the lung parenchyma by the pneumonia. So this is called lung abscess. Second, এটা parenchyma হলো. Second কি হতে পারে? There may be pleural effusion. Okay. Followed by empyema. What is empyema? Pus in the pleural cavity. Empyema, pleural effusion, lung abscess. These three are the most common complications of, local complications of pneumonia. Okay. So this is empyema. So this is a straw color pleural fluid. This is normal color of pleural fluid. Normally কি pleural fluid আমাদের lungs এ থাকে, প্লুরাতে থাকে? Normally আমাদের সবার আছে pleural fluid? Definitely আছে, but it is less than 50 ml. If it's more than 50 ml, then it's called pleural effusion. Okay. So this is the normal characteristics of the normal effusion, but this is empyema. This is pus in the pleural fluid. So this is lung abscess. Destruction of the parenchyma, which results in pus-filled cavity in the parenchyma. কি করে বুঝবি? This is a cavity. দেখতে পাচ্ছিস এখানে একটা ওয়েল ডিমার্কেটেড একটা মার্জিন আছে, রাউন্ড মার্জিন আছে, তার মধ্যে ইনসাইড দ্যাট ক্যাভিটি কি আছে? একটা এয়ার ফ্লুইড লেভেল, দেখ হরাইজন্টাল একটা লেভেল, দিস ইজ কল্ড এয়ার ফ্লুইড লেভেল। এখানে এয়ার অ্যান্ড ফ্লুইড আর টুগেদার, সো দিস ইজ কল্ড এয়ার ফ্লুইড লেভেল। দিস ইজ লাং অ্যাবসেস। অ্যান্ড what are the systemic complications? কি কি idea? Any idea? Sepsis, septic shock, multi-organ dysfunction, right? And respiratory failure. Infective endocarditis. কিসে হয় infective endocarditis most commonly? Staph aureus, right? Okay. So this is end of the class. এখানে কোনো ডাউট আছে regarding this is investigation part. আর নেক্সট ক্লাসে আমি পড়ব হচ্ছে ম্যানেজমেন্ট পার্ট অফ দ্য নিউমোনিয়া। ওকে, এনি ডাউট? এখান থেকে কোনো ডাউট আছে? ওকে।